Hey, it's now time for Ask the Doc with Dr. William Whaley. He's not with us today. Joining us, Dr. Ray Tidman is with us. This is brought to you by the Georgia Cancer Research Center, affiliated with Northside Hospital. Dr. Tidman, how are you today?
Very good, very good.
This
drought's just killing me, though.
Is the drought?
Oh, yeah, it's just, I'm scared to death for the fires we're going to have.
Oh, so you start, the jokes when we get done.
Oh, okay.
All right, so the drought, yes. I have a question for you.
All right.
We have the medical questions. Did you hear that storm last night?
A little bit. It was rocking and rolling at our house.
We have the 50-pound dog that can't take it.
Yeah.
And, storms like that. So it was a rough storm last night. Glad you're able to fill in this morning for Dr. Whaley. Always a pleasure to have you with us. Let's start with our first question. I have migraine headaches very often, usually twice a week, sometimes more. Even when it doesn't reach a migraine, I often feel I have a dull headache pressure. My mother is worried this might be something more serious. Should I be worried that it could be a tumor or something?
So there's a question buried in that question is, first of all, is it a migraine? There's many different kinds of headaches. And I'm assuming, because she's used the word migraine, that she's been diagnosed and been properly worked up. If she's not been, if she's just assuming that this is a migraine headache and it's not, then there could be problems. There are brain tumors, there are other things that go on, elevated blood pressures such as that really need to be found. So let's assume that she does have migraines. Migraine treatments have really come along greatly, and particularly the prevention. Just in the last 6 months or so, there's been a new medication released. It's an injection. You can either get it monthly or quarterly, that for 50% of the people, it knocks their migraines down by half, the occurrence of migraines. So that's a very innovative product. Not a lot of people know about it yet, but check with your doctor, you can find it. I think the most important part of this question is the person really experiencing a migraine or not, and they need to see their doctor for that amount of headaches.
Well, let me ask you a follow-up on that. How do you identify migraine? What is, when you have headaches, because somebody will say, I feel a migraine coming on.
Yeah.
How do you identify migraine, and how do you know it is a migraine versus maybe another kind of, maybe a tension headache?
Yeah, most common headache's a tension headache. It's more of a muscular headache. It's
right.
It's kind of a spasm, muscle spasm, tension. Whereas a migraine's a vascular headache, and it has a different sense to it. If most people at one point in their life have had a tension headache, so they know what that is. Migraines are very different. They frequently come with what we call an aura, that is a warning, like a smell, or maybe jagged lights in their visual fields. There are different sensations that can come before the migraine that warn the person that it's coming on. Migraines can be very severe. They just shut you down. You've got to go get in a dark place, or you've got to find some medicine to take. Certainly get out of a lot of stimulation. They really can be very debilitating. They're similar to cluster headaches. Cluster headaches happen a little bit more in men. They tend to be one-sided, like behind one eye. Also very severe. Migraines and cluster headaches are very severe things. But the bottom line is, A, make sure that you've been diagnosed properly, and B, there are good treatments for them now.
What would you say, who gets who has more migraines, men or women?
Women tend to have more
Okay.
migraines. Men tend to have more cluster headaches. Both of them are what we call vascular headaches.
So if I feel a headache back here, those are cluster headaches behind the eye?
Yeah, usually it's behind one eye or the other.
Right.
Interesting thing about cluster headaches, we don't really understand why, but you give that patient oxygen, you just put some oxygen on them, a lot of times it'll go away. So headaches, the study of headaches is a very fascinating area, very common disorder. Most important thing from this conversation is don't diagnose yourself.
Well, that's what I was going to get to. We have so many, we have so many over-the-counter medications in the drugstore, we can go down an entire aisle of pain relievers
Yeah.
for a headache. But when is a headache something that I think I need to make a doctor's appointment?
If it's disrupting your daily activities, if you're like having to stop your work, or you're stopping your fun stuff because of the headache, or just sitting in a dark room, yeah, get that worked up. You mentioned something else about over-the-counter products. There are a lot of dangerous over-the-counter products, so be careful about that. Over-the-counter products is the Wild West. People can sell anything as long as it's not killing you. They can get away with selling it. But migraines in particular can be your diet can very much affect your migraines, particularly the amount of caffeine that you change in your diet. So if you're a heavy caffeine drinker and you stop or start, you're up and down in the amount of caffeine you take, you can be triggering your migraines.
So if I don't mean to stay on this subject because there's so many different headaches to me. There's different headaches, and everybody seems to have a little. The headache comes on different for them.
Right.
So, but I will know. I drink coffee in the morning.
Yeah.
All right. Not in the afternoon or in the evening, but I drink coffee in the morning. And if for some reason I get in a position to where I don't have a cup of coffee till 9 o'clock for some reason, I'll say, hey, this is a caffeine headache. Is that true?
Definitely can have a caffeine headache. And that's different than triggering a migraine, but there are caffeine withdrawal headaches. And so my advice to patients who are caffeine drinkers, whatever's their source, Mountain Dew or some of these energy shots, is just be consistent. To do the same amount regularly. And of course, if you're a heart patient, you really need to talk to your doctor about caffeine intake, because too much caffeine is a problem.
Well, that's a whole nother subject.
A whole nother subject.
Yeah, that's like preaching when you start talking about people's caffeine in the morning, right?
We don't want to go there.
Gotta be careful with that. Okay, now you promised you're going to help me. You told me with the words.
Take your best shots.
Angiosarcoma.
Angiosarcoma.
What? Angio. A-N-G-I. Yeah, not angor. Angiosarcoma.
Yeah.
Angiosarcoma. Okay. Wow. I am going through cancer treatment for angiosarcoma. I have heard that deep vein thrombosis. Did I get that?
Got that right.
Wow. Could be a risk factor due to me being on bed rest for some time. Is there anything I can do to prevent blood clots or DVT?
Yeah, so that's a good question, and we can expand it a little bit.
We're expecting about 22 minutes on this question, because usually that's.
No, I didn't bring any diagram.
I don't want to get in trouble with our dear friend.
So let's just talk about. I'm being treated for cancer. Okay, angiosarcoma is a very specific cancer, but
What is that?
Well, angio is Latin for blood vessels,
right?
And sarcoma is like a hard tumor. So it's a fairly rare tumor. Thrombus is the clot, and bosis is the condition of clots. So you're having blood clots in your body. Interestingly, sometimes a patient will come in with a DVT, a deep venous thrombosis. That means that they've got a clot in a deep vein, which can be deadly. And they'll present to the doctor with a swollen leg. And
I don't want to get off this. I don't want to get off the track of answering the question. But how do you know that as a person?
Well, if you come in with one leg swollen more than another, or an arm swollen more than the other, usually it's an extremity, foot or hand. That's not something to mess around with.
All right.
Any swelling that's acute that comes on suddenly, that needs to be attended to right away, because that you can form clots. But where I was going to with this answer is that sometimes a patient will present with unilateral swelling in a leg or an arm, and the doctor will start treating the swelling, and then we'll work up the possibility of cancer, because the condition of cancers causes us to be more clot worthy. That is, our blood is more likely to cause clots and cause problems. So that person's question is right on. Yes, I have a cancer. Yes, I'm at higher risk for blood clots. How do I deal with it? How do I prevent that? Well, first of all, you try to stay as active and as healthy as you can. Activity levels, muscle activities, moving your blood around in your body is preventative. sometimes the doctor, dependent upon the treating physician, dependent upon the other patient's risk factors and their other medications, will put them on at minimum a baby aspirin, sometimes baby aspirin and Plavix. And now there are newer agents, oral medicines, that are really slick because you don't have to be tested all the time. But there's blood clots and DVTs and thrombosis is a frequent killer. In the old days, when somebody was diagnosed with cancer or they had surgery, they were put to bed. Well, they usually survived the surgeries and died of the blood clots. So we've now learned to get patients up, get them moving, and get their blood thinned. And the older thinners, the more aggressive thinners, were heparin. You might get a subcutaneous heparin shot once a day or twice a day, or a heparin infusion. If you're in the hospital, we gave patients a constant drip of heparin, and sent them home on Coumadin. Coumadin can be a very dangerous medicine, has to be monitored regularly. But now we have some of these newer medicines. So the newer ones are really nice because they're not only used in heart patients who have conditions that tend to make them throw clots, but they can be used in cancer patients who are prone to DVTs.
You know, I've noticed through friends and family members that have had major surgeries.
Yeah.
That even though they've been through a major surgery, still motion is something they come in immediately and start making sure happens is motion.
Yeah.
Immediately, you know, they don't let you sit there. They start getting that motion going any way they can, you know, determining how serious the surgery or how you're not able, you know, to have the motion, or you know what I'm saying.
Oh yeah, the surgeon, as part of their post-operative orders, next day, right, UOB, up out of bed.
Yes.
And with those nurses getting that patient up.
Yes, I was shocked. In fact, I was actually one of those. Like I was.
They wrote UOB several times in the charts.
Yeah. Yeah. No, I had surgery one time, and like they came right in, and they're like, "Okay, we're gonna get up. We're gonna take a walk." I said, "No, I'm not getting up. I'm not getting." Do you realize what I'm one of the.
What I've been through here.
Yes, I'm a
Those
great.
guys with the long knives have been working on me.
Yeah, I'm a great patient. I'm a great patient. First surgery. I've got the anesthesiologist, and I'll never forget this. First surgery, appendectomy, right?
Yeah.
Hey, there's my question. I don't care who laughs out there. I do not care. Tell me, in the medical world, how did we get to appendicitis, and then we switched over to an appendectomy? How did that? Can you answer that for me?
I don't know.
I mean, I do understand.
I just, I'm not a verbal kind of guy, so I'm
Break
worthless.
that down for me.
Yeah. Why is Latin so heavy into our medical world?
All right. So you understand?
Yeah, it's tough. It
I think I got a
adds
problem
to the
with
complications of understanding what's going on.
You got to go. I think I have a problem with my appendix. Oh, you have appendicitis, and then you stretch all the way to an appendectomy. So,
yeah.
Sorry. But the first time I go in, right, surgery, and it was appendix, and I never had surgery in my life, so I don't know what to expect. And I'm seeing everybody float around this room with these masks on, and it looks like they're sharpening knives. That's what it looks like to you the first time, right? And I see the guy say, "Hand me this." There's an anesthesia, and I'll never forget the last words I said is, "Don't start." I'm
still awake.
Yeah, don't start. I'm still. But that's the last I remember.
Yeah.
So, anyhow, well, I appreciate you very much. I appreciate you coming and being with us. And we want to thank Georgia Cancer Specialist, Georgia Cancer Research Center. Sorry about that. Georgia Cancer Research Center, affiliated with Northside Hospital, for our segment. So, do you have some humor to leave us with?
I do. I had a patient. He came in. He was kind of upset because he's a typical guy. He was upset by his wife's response.
You did jump into typical guy. We may have to figure out
what is a typical guy. I don't know.
Right.
Yeah. So anyway, his wife had a look of consternation on her face, and he was trying to be helpful. So he said, "Honey, I think you need to learn to embrace your mistakes." So she went over and gave him a hug.
Okay.
All right.
So that's
it.
That's it. How's everything else going?
Doing good.
Good?
Doing good.
Anything in the medical world out there that you want to share with us, or anything going on you want to talk about?
I don't have anything in the medical world. I'm kind of excited about something happening in the community. I think there'll be news coming out, but there's a new development that's occurring where there might actually be a new beautiful venue for weddings here in Fannin County, and it's going to be nice.
Oh,
I'll
so
give you a little teaser about it.
You got a little teaser on that, huh?
Yeah.
You'll have to come back and tell us more. Again, thank you, Dr. Tidman, very much. We appreciate you. And as Dr. William Whaley says, and after he answers every question, he says, now if that's not enough, or if you're at this point, you got to make an appointment with Ray Tidman. So we have him here, so don't hesitate to make an appointment with Dr. Tidman today. And we want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for supporting this segment. Don't forget, if you go to FYN TV, Fetch Your News YouTube channel, and you click on the playlist right there, Ask the Doc segments, they're all loaded right there, and you can share them with your family and friends. Anyone, you can share them there. Great information every week. Again, thank you. Right as soon as we get done, on the other side of these commercials, we're going to give Rick like an hour to say whatever he wants. You want to come back, you want to hear that. I hear he's been studying. So, Rick's star of the show as soon as we come back. Take us to break, Josh.